Hello, everyone, and welcome to the Medical Fitness Podcast. I'm Jeff Young, and in this episode, my co host, Dr. Thomas Hammett, and I speak with the president and CEO of the Medical Fitness Association, David Flench. Our podcast is brought to you by the Medicine, Rehab, and Fitness Institute and JY Kinesiology LLC, both of which are dedicated to medical fitness education and building the bridge between medicine, rehab, and fitness. You can learn more at mrfinstitute.org. Purpose of our podcast is to provide you with principle and evidence-based content on all things related to exercise science, strength and conditioning, medical fitness, and building the bridge between medicine, rehab, and fitness. In this episode, David gives great insight into what medical fitness is and what it looks like in the US today. How critical it is to develop trust between clinicians and fitness professionals to enhance collaboration, and examples on how to do that, some of the biggest challenges that separate our fields, the importance of medical fitness in the current obesity medicine explosion, and much more. We really had a great discussion. So without further ado, let's get started. All right. Hey, everyone. Welcome to the next episode of the Medical Fitness Podcast. And I'm really excited about this one because we have a special guest, David Flench, who is the president and CEO of the Medical Fitness Association. So, David, thank you so much for your time and your willingness to be a guest on our podcast.
Well, thank you, Jeff. It's my honor to be here.
Yep. So, and then obviously there we have my friend and colleague and co-host, Dr. Thomas Hammett. Thomas, always glad to have you on board, and thanks for showing up as well.
Yeah, I'm excited to be here and chatting with David today. And you, I
Yeah,
guess, too, Jeff.
yeah, I guess so. Any case, yeah, so let's get right into it, and like we do with everyone, the intro. So David, can you do me a favor, or do us and the listeners a favor, and tell us a little bit about your background, your story, and really, if you don't mind, start before becoming the president and CEO of the Medical Fitness Association, and just how did you get started with your career, fitness, and your trajectory?
So yeah, absolutely. Those who can't see me and only hear me right now, you don't see all the gray in my beard. So I've got about 25 years in the industry, and some of that's from my kids, and some of that's from the industry. But it's been my career has been devoted to medical fitness. I started out I got my degree in exercise science from the Ohio State University back in the 90s, and really from there, my first real job experience was at the McConnell Heart Health Center in Columbus, Ohio. It's a really big, comprehensive medical fitness center, and that's where I really, started and learned a lot about this. In fact, I was just talking the other day this week with one of my mentors who really pointed me in a lot of the directions that I was about to go in my career. And it's always great to thank those people. That was part of the reason I got
Yeah.
back in touch with him. His name's Gary Richards. He's moved on to some bigger and better things within healthcare. But it was just an opportunity for me to thank him. But when I was at the McConnell Center, I was fresh out of exercise science school, and he ended up, one of the things he pointed me towards was my MBA. So I got my business background to go along with the exercise background, so that I could I really wanted to focus on managing in this industry. Um, but another thing he did, coincidentally, was he introduced me to the Medical Fitness Association, and he pointed me to one of the conferences, and that was 20 some years ago, and I think I've been to every conference since, every year. And now here I am running the Medical Fitness Association. But so early on, I was an exercise physiologist, helping people on the fitness floor with a variety of programs, and like I said, kind of got into the management side of things. I went down to Florida for two different stints at two different facilities as director of those medical fitness centers, and those were both about a year old when I got to each of them, and hadn't really taken the step to becoming an integrated medical fitness center. So my job was to really implement those, And so we did some great things at those facilities. The one down in southern Florida, I also opened a diabetes education center for that hospital, and put it as part of the medical fitness center. Worked really well, being going hand in hand with all the programs and services that we offered there. And then I went up to Sarasota and spent a few years there. It was also a brand new facility, so a lot of the legwork in getting the programming going there and putting in the medical fitness model. They've since become certified by the MFA, which is always a proud thing when that happens. But then one of my mentors, another mentor of mine, Doug Ribley, from up in Ohio, and incidentally, he was the president of I'm sorry, he was the chairman of the board for MFA when I first joined, and so he was always, somebody that I went to and tried to, learn as much from him, and then over the years just worked closer and closer with him. He recruited me up to Indiana, where I currently still live in Indiana, just east of Indianapolis, and to the Hancock Wellness Centers, and that wasn't a brand new center, but it was a center that needed a turnaround, and it wasn't really functioning as a medical fitness center. It was owned by the hospital, but it was more or less a commercial facility. And so my job was to implement the medical fitness model and, really integrate it into the fabric of the hospital and healthcare system there. And we really did some special things there, got it certified also by the Medical Fitness Association. And by that point, I had served on probably every single committee of MFA, and then joined the board of directors. And then we opened another facility for Hancock in the county, and did some great things with that. That was also certified, and then built a third one. So we really did some great stuff with Hancock Wellness Centers. I'm really proud of those, and they're still doing some really amazing things. But I became the chairman of the board myself for MFA, and then had the opportunity about 2.5 years ago now, a little bit more than that actually, to become the president and CEO. And I thought, I'd been on the one side, a member, a board member, all these things with the association. Now there's the opportunity to lead it, and I'm glad I made this move over, because it's been great. It's helping others, connecting others with their colleagues and peers in the industry, and providing resources for them to be successful. That's really been a great part of how I've moved into this phase of my career. And but yeah, so I've had a lot of different roles, and just happy to be where I am right now.
You alluded to some things that I would like for you to expound on, if you don't mind. As I mentioned to you before we went live here, I teach a couple courses for a movement science program here in New York City, and one of my classes I teach, our first class was yesterday, and during the class, one of the students asked me during the introduction part what my advice is for like becoming successful in the field. And this is something I love. I always, whether they ask me or not, I always talk to them about this. And I always go back to my days as a junior, and between my junior and senior year at Penn State, when my academic advisor, Dr. Bill Kramer, and I was a returning adult student, so I was 30 years old as a junior. And without going into a long story, I was scared, like a lot of people who are getting ready to graduate, what am I going to do with this degree, and what are my opportunities and stuff like that. And I asked Dr. Kramer, what his advice was, which is part of my advice for everybody now. And he basically said, if you have the time, the finances, and the desire to go on to grad school, do it, because not only are you going to get the knowledge and the skill set, but it's going to open up opportunities that you just don't realize right now will open up for you. And he ended up being exactly right. But he also said what's going to make you successful in your career is networking, networking, networking. It's exactly how he said it. And it's 29 years later, and I still remember it like it was yesterday. So when the student asked me this, that was part of what I told him. But another thing, as I said, which you alluded to in your introduction, was get involved with organizations, get involved, and just get involved. It's going to be you don't realize it now, and you might be scared in the beginning, but it's going to the net that's going to provide you your networking opportunity. So if you can expound a little bit more, I'm just curious, because you said you went from member to committees and stuff like that, and that's typically the trajectory, right? So tell me just a little bit more about your trajectory through the MFA. How long were you a member? Were you scared when you first got on a committee and, oh my God, I'm on a committee now, what do I do? What did the process look like as you moved up and now here you are, the president and CEO? And part of the reason why I asked that is because A, I'm really interested, and B, I think it's good for our listeners to know this too. We're going to have a bunch of student listeners, clinicians, professionals, but students as well. And I just think it's good for people to hear these types of stories.
Well, yeah, Jeff, first of all, I couldn't agree more with everything you just said. And that has been absolutely the case in my career. The networking, getting involved with professional organizations. I mean, I've always considered Medical Fitness Association my number one, but ACSM's another one of my big ones. And then partway through my career working for hospitals, I got involved with the American College of Healthcare Executives. So yeah, I think, and I've really benefited from each one in different ways, for sure. But they've also, just been a key part of, I think, my successful career path. And and I always say, you know, you get out at least as much as you put in.
Yeah.
It's always the case, and and the opposite is true. If you don't put much in, you're not going to really get much out of it. So people who kind of say, I joined this organization, but I didn't really get that much out of it. It's probably because you didn't get involved very much. So early on in my career, and this was funny when I was talking to my mentor that I had mentioned earlier, he was saying, Dave, you were just you were motivated. It was easy, and so he was acknowledging that part, and I think that's part of it. You have to be motivated to, you know, have new experiences and learn from others and be curious about things that you don't know about. I'm still curious. I was on a webinar yesterday listening, and I thought, man, this was some great information. I'm glad I was on this thing. But yeah, I can remember going to the first conference for MFA, and I didn't know anybody there. And luckily, I think this is pretty true of the MFA community and maybe medical fitness and as an industry as a whole. But they were very inclusive and wanted to really pull me in. And I felt that. Like I said, I went up to Doug Riley, the chairman of the board, and just started a conversation with him. I remember talking to Brad Roy, another person I
Yeah.
consider a guru in the industry. He's out in Montana, and now I consider him a friend and a colleague. But you know, just those getting out of your comfort zone and going to talk to people who have done it before and can share their wisdom. I mean, that's one of the things I love trying to do now myself, is to pass along. It's that pay forward type of mentality. But yeah,
Right.
I talk to people about how can I get even more involved with MFA. So there's some of the committees and task forces. I sat on the initial task force for the uh, MFA facility director certification. So we did that probably 10 plus years ago, and that turned into something great. But it was myself and a few others in the industry had actually made a recommendation that, hey, there's really a void for that type of thing, and talk to some of the folks at MFA at the time, and we put together a task force. We all worked together, brought people from all over the country together in multiple sectors of the industry, and I still have great friendships with a lot of those people today, where you can call on them for all kinds of things. So yeah, I ended up joining these committees, and yeah, I think at first it's best oftentimes to really just absorb your first maybe committee meeting,
Exactly.
and yeah, kind of figure out where this thing's going, and then find out where you can contribute, and whether it's contributing some of your expertise, being some of the manpower type of things, doing some of the work that's needed to be done, all kinds of stuff. That's one of the great things about the association. It's really the involvement of the members. We see that all the time. We have some folks, it's like, man, I want to clone this person because they just, they're giving of their time. But I think those people also recognize that they get a lot out of it. So, it's 100% true from my career that I have benefited much more than I ever realized going into these things. I don't think you think about it in those terms when you're first getting involved, but I have people that I'll give hugs to at these conferences because they're friends that I love seeing them. You see them a couple times a year, but yeah, I mean the networking is amazing. I think that's huge. I encourage it to all of our conference attendees. I say, if if you do nothing else, meet somebody that you don't know and create a new person in your network. And you never know when that person will be needed, but and they might need you, and you may be able to help them as well, and that's always fulfilling too. So yeah, as I look back now over 20 some years of being involved, like I said, on the other side of the MFA, now I'm running it, and that's just been awesome too. So you never know where some of these things can lead, and in my case, just getting the advice to go to a conference and try to get involved has led to some pretty cool things.
Yeah. And I'll just add to that another reason why I suggest to people to get involved, like there's a zillion reasons why people should get involved. But one of the things that's really helped me or benefited me is it widens your perspective. You get to see what's going on at the organizational level, right? So even if you never move up to the board level or the president CEO level, you still get to see what's going on, and it just widens your perspective of the industry in general, which is always a good thing. So not only do you get the networking out of it and all the things that you just said, but there's just so many other benefits that people don't realize. So yes, to the listeners, I just highly recommend you get involved with the Medical Fitness Association and just organizations in general, and then hop on a committee at some point. Don't go in with guns blazing, just like David said, just absorb, and and a lot of times things will just happen, and you don't even have to worry about it. You'll just be put on some sort of project, and next thing you know, you're collaborating with a group, and next thing you know, you're on another committee, and the next thing you know, you're the president and CEO of the organization. So yeah, I really appreciate that. The next question I have for you is, now let's just kind of bring it down a little bit and talk about medical fitness. And I'm curious if how do you define medical fitness would be part of the question. So how do you, as the president and CEO of the MFA, define medical fitness? What does that mean? How would you describe it in an elevator pitch to the listeners? And can you give us a picture of what medical fitness looks like in the United States today?
Sure. Yeah, and you kind of hear different definitions from different people. Hopefully, I can be somewhat eloquent as the president and CEO of MFA, but
Put
um,
pressure on you.
part of part of this comes from my experience. Part of it is just understanding the industry and looking at it from different perspectives. Like you said, you get different perspectives from different people. But really, when I think about a medical fitness center, it would be a facility that is in some way medically integrated, and that shows up differently in different settings. Um, but it promotes these healthy lifestyle choices, and focuses on more of the prevention and sometimes the treatment of chronic disease and uh, illness and injury. And so it really, the in a medical fitness center, it's not just physical activity though. That's one of the keys. I think it incorporates more than just that, more than just your typical fitness center. So nutrition, health and wellness education, chronic disease management, integration with rehabilitation, and even into the integration within the entire healthcare system. Even if you're not a hospital-based facility, there's ways to affiliate and integrate with those services. So I think and there are various components of the model. So I talked a little bit about the medical oversight. I think that's a big piece of it. When you talk about a medical fitness center, one of the differentiators is having some sort of whether it's a medical director or a medical advisory committee, something to provide oversight, recommendations, be a liaison to the medical community for the facility. I think those are all important things. Another component I would say would be quality management, kind of the outcomes tracking and focus on reporting and communicating outcomes. That's something that you often don't see in just your commercial gym, but as part of a medical fitness center, that's got to be one of your focuses. I'd say once you have the medical oversight, you also have to have the professional staffing. So your fitness staff has to have a degree and accredited certifications to be able to serve these special populations. And that's then the next component. It's what I call clinical fitness programming, that addresses various populations within the community, and that's oftentimes one of the driving motivations for facilities who might be making a transition. They want to attract a new population into their facility, and so and that's what I talk about that a lot too. It's you've got this core of your center it probably looks a lot like any fitness center, right? It's got the treadmills and the strength machines and maybe some group exercise studios and a pool, maybe things like that. And that's all very, it's a commodity essentially. But the layer on top of that is the programming. It's the professional expertise. It's the focus on safety. That's another big factor. Having this new population of folks who might not be comfortable in another facility, but come to you because they have a program, let's say for Parkinson's, and you've got the expertise, but there's safety considerations that go along with that. So having a preparation plan, being ready to handle some emergency situations. That's very important too. So I think there's probably more that I haven't hit on in the model, but those are some of the key things that I think define what a medical fitness center does and should be doing.
It's great. Thank you, David, for sharing that. Before we started today, I even wrote down a little bit for myself. Jeff and I were talking before the call about, if we were thinking about what a medical fitness facility should provide, and the 3 bullet points that came up to me were collaboration between fitness professionals and some form of medical staff within the facility or medical oversight, that there should be medical prescription, and that there should be management of data and outcomes related to the patients. So those are the 3 components that we came up with, which is directly in line with what you were discussing. I'm curious if you could share a little bit, because you mentioned earlier about certification, what MFA certification looks like and how a facility ends up going through the process of becoming certified, or what those qualifications are.
Sure. Yeah. Like I said, a couple of my own facilities became certified. I became a lead examiner for MFA over the years. So I've been out to dozens of facilities across the country, going on site visits to evaluate them for facility certification. I was on one of the committees that I was on was the certification committee for MFA. So yeah, I'm pretty well versed in that, and of course, running the organization now have to be. But right now, the latest version of our facility certification checklist has 131 standards and guidelines. So and that's actually pared down from where it originally was over 200. Um, so it's very comprehensive, a robust set of standards and guidelines that a facility must meet. Um, Technically speaking, a facility has to achieve 90% of the 131 standards, and of course, all of we have pass fail guidelines. So all of those must be met as well, and that's about a third of the standards, maybe somewhere in there. So it is a challenge. I'll tell you, when I first got to the Hancock Wellness Centers, I that was one of my goals, to get the facility certified, and one of my first steps was to determine, how many of these standards are in place already. And I think we were at maybe 50%, 56%, something like that, of the standards. So we had a long ways to go. And I'll tell you, it took us about 18 months to go through it all and feel really good about it. Now we passed with should have been 100% in my opinion, but we missed one apparently. So we wanted 100%. That was our goal, and the next time we did get to 100. But there's 9 sections within the standards and guidelines. It's medical oversight. It's the quality management, pre-participation screening, safety and risk management is one. You've got clinical programs and services. You've got professional staffing. Cleanliness is part of within there's a facility section. Children and youth, aquatics. What have I missed? I think I've probably hit all of them, but so it's a wide variety of standards and guidelines that folks must go through. And typically, I think you see at least a year of preparation. So it's not usually something that facilities can just say, "Oh, I'm going to apply next month for this," unless they just kind of have had that mindset from the get-go and somehow lucked into meeting all the standards. It's usually something that takes some time to really understand it, and part of it is documenting your processes, so that that type of operating procedures lives on beyond the one director who was there during the certification. That's a big part of it too, making sure it's hardwired into the organization. And so that's part of what we try to encourage, is having everything well documented for the evaluations. But I tell you that really a big part, I mentioned the differentiation piece earlier, and that's certainly a really big part of it. But another, I think, is by being certified, you really start to gain the trust of the physicians and other healthcare providers, that you're asking for them to send their patients to you. And I think, in my experience, physicians can be pretty wary of where they send their patients, and so the more you can do to create a level of trust, the better. I think even it was interesting, even being a department of the hospital in some of these centers that I ran, the trust wasn't always there with the physicians who were also employed by the hospital. So it wasn't just an automatic thing that you're both part of the hospital and there's already some trust. I don't think that's how it plays out. We had to work to really gain the trust of the physicians that we were asking them to send into our programs. And so I think the certification really helped that, because we could demonstrate, here are a lot of the guidelines that we comply with, and we've achieved the full certification. So I think that's a big part of it too.
Yeah, I can tell you from our experience up here in the Northwest, in the Seattle area with Valley Medical Center, every certification that we've gotten in our clinics, whether the cardiac rehab facility through AACVPR, our diabetes education group through the ADCES, those things do immediately build trust and better process. We are now, committing to adhering to a set of guidelines and being worthy of that certification year in and year out. And it does. It makes us be accountable to a higher standard of practice. So a certification like that, certainly in the areas that you specified earlier, can only improve the care that's being provided and what exists for the folks in those populations. So it's great. Maybe I'll take a step back. We went into certification, and I think it may be part of the answer to this question that I have next, but I'm curious what your primary initiatives are really today, both for you and just the Medical Fitness Association in general, that you're really focused on right now.
By the way, most people looking for the services of a fitness professional are really just looking for information on how to get started on the right path, not to pay for training sessions every week for months or years on end. For the 60 to 70% of people with chronic disease and or joint pain, they're also looking for someone who can help them develop a clinically safe, individualized exercise program that takes their conditions into consideration. If you're interested in getting yourself, or for clinicians, your patients, started on a safe, cost-friendly medical fitness program, you can find more information about the virtual services we offer at mrfinstitute.org/services. We staff only degreed kinesiologists and exercise physiologists and will work with your healthcare providers in the design of your exercise program. For the clinicians listening in, you can add this virtual service as a reduced cost option for your patients. Check out our website and send us an email, and we'll give you the details about this unique and much needed service.
Yeah, that's a good question. One of the things I'm working on right now is our benchmarks publication. So MFA has put out that data usually almost every 3 years. The pandemic really put a hamper on us being able to get that out. But earlier this year, we put out a survey to our member facilities and have got back a great response to that. And so now it's the analysis and write up of that. And I'm really excited about getting that out to our industry. I'm hoping within the next couple of months we publish and distribute that to the industry, because it really helps guide facilities on being able to compare theirs to others. In the we show the top benchmark data for our facilities, and so we always used it in my facilities to kind of guide our goals. Have something that let us know, are we doing a good job? It's more objective than just saying, yeah, I think we're doing well here. But so that's a big project right now that I'm excited to get out. But of course, we've got our annual conference coming up here in just a couple of months in Baltimore this year, and it moves around each year, and this year we're also putting as a pre-conference event our Leadership Institute. So Medical Fitness Leadership Institute usually is been its own separate event. We're putting it right up the day and a half before the conference starts. So kind of excited about some of the things that we're doing through that. So the slate of speakers is really awesome. Our keynote this year is Dr. Jonathan Bonnet. He's a lifestyle medicine doctor. He's involved with the ACLM, American College of Lifestyle Medicine. And so I'm really excited about that. Plus, you get everybody back together and the sharing of ideas and the networking and all of that, of course, that we talked about earlier. But so that's, a big initiative that we have. We're planning for that. And then, of course, I think just supporting our existing facilities, and we're getting new facilities joining every day. So, being a resource to them and, connecting them with other MFA members and, just guidance on the various challenges that they have, I think is always a big thing for us. And then, certification is happening. I just got an application from a facility over in Austria. So, there are facilities all over the world that are looking into this, which is really pretty cool.
Yeah.
That's great. I am curious because the first initiative that you mentioned is something that I'm really, really interested in, which is benchmarks. When you're talking about benchmarks, I imagine that some of the data that you guys are tracking is related to demographics, like number of members, maybe things like socioeconomic status and that kind of stuff. But what other data are you tracking that are benchmarks that you would share with other with the MFA members?
Yeah, so in this case, it is mostly the financial and business statistical information. It's less about the health, and fitness related participant outcomes, but it's more about the facility outcomes. And so, yeah, we get all the information about the size of the facility, the number of members, the financial, components, whether it's total revenue, non-dues revenue, all these things. And then what I think is really powerful is how those go into the ratios so that, me as a 100,000 square foot facility can still relate to what a 20,000 square foot facility has, or, you take a bunch of different characteristics, but you make it a ratio that then you can get a grand average for and a benchmark average. And now, I can look at these types of factors and say, okay, my members per FTE is little out of whack. I got to figure out how to adjust things to really, be more efficient. Maybe, some of these things are about how to be most efficient. And one of my mentors always talked to me about the way, a lot of these facilities, there's a great mission to serve certain populations, but without a margin, there can be no mission. So you got to be smart in how you're providing these services. And even if one executive at the time, tells you, oh, it's, don't worry about that. That executive might be gone in a couple of years, and the next one says, "Oh, it's very important. We can't be, losing any money," and so forth. So I think being able to not only provide great services and programs and delivering on outcomes, that's absolutely important. But running a very, tight operation, a smart operation to be able to do that. And so that's what a lot of these benchmarks help guide folks and say, okay, if you're not looking at this at all, this is something to keep in mind. If you are, but you're not quite at benchmark yet, start putting in strategies to improve your operations accordingly.
You mentioned John Bonnet. I have to chime in on that one. John's a friend and colleague. So I've known John since 2016. I met him through the ACLM, the American College of Lifestyle Medicine. We actually co-authored a book together. Don't get mad. We call it the Medical Fitness Bible. And so yeah, so we co-authored a book together, and actually Thomas and I and John and Dr. Andrew Mock, another colleague, are working on a project. So yeah, we know John really, really well. Amazing guy. So yeah, that's very cool. There's just another like small world example, right? So
Absolutely.
but I also just want to say, and to get your opinion on something, is that in 2018, so I've been involved with the ACLM since 2015, and I actually was the founding chair of their medicine, fitness and medicine member interest group, and that was from 2017 to 2020. In 2018, I presented at their annual conference in, I think it was in Indianapolis, and co-presented with John. And one of the things that I talked about that I'm just curious your opinion on was one of my I've worked at four hospital facilities: Duke, UCLA, Mount Sinai, and Beth Israel. I've also worked at several private practice facilities, physical therapy in name, but they would also have like physiatry and occupational therapy, etc. And my first time working at a physical therapy private practice was actually out in LA. It was called Westwood Physical Therapy. And while I was there, and I had come from the Dr. Rob Gotlin and Beth Israel facility. My wife and I moved to LA. We thought it was going to be permanent. We were there for a year. We realized it wasn't for us, and I actually again ended up getting my job back at the facility under Rob Gottlieb. But that aside, when I was out at Westwood Physical Therapy, at some point the light bulb went off in my head, and I thought to myself, these are and the way I word it, and actually the way I worded it in my presentation at the 2018 ACLM conference was physical therapy facilities and private practices are medical fitness facilities waiting to happen. That's because right, because the patients coming in have the disease, they have the obviously the musculoskeletal pain that they're coming in for, et cetera, et cetera. And I just that's part of where my passion is. So I'm actually I just for example, I present for a local doctor physical therapy program at a local college here in New York City to second year DPT students, and I will bring this up in the presentation. And usually by my second or third slide, I'm saying to them, with over 18,000 private practice physical facilities, physical therapy facilities in the United States, and over 300,000 physical therapists, and the opportunities for these types of facilities to be medical fitness facilities or have a medical fitness component. And then in your case, potentially a certified medical fitness component. Then I'll just talk about the disconnect and how, what are your thoughts on that, et cetera. So that's part of where my passion is. I just feel like, maybe at a level, I don't want to say below, but just at a different level other than the hospital systems. When you hear me say that, what thoughts go through your mind? Is this, I know there'd be maybe potential logistical issues or whatever, but what goes through your mind when you hear me say that? Do you think that there's potential for this um, whatever your thoughts are?
Yeah, I 100% believe that the two should always be working hand in hand. Now, my experience is from that other side of a hospital-based medical fitness center that all of my facilities always had a physical therapy clinic within, so in the same building. So, what I think was really wonderful for each side, the integration of the two was on the physical therapy side. I think I'd hear a lot about, well, we now have much more equipment. We have a pool that we can use. We have a place that we can feel good about referring the patients when they finish to continue at. And then on the medical fitness side, it was having some additional expertise in the building. That was one big thing. I early on in my career, I started asking the physical therapy department to come give in-service presentations to my teams, and go a little deeper dive into certain whether it was a musculoskeletal condition or so forth, because that can always help. But really, then you've got the benefit to the member and the patient, and it almost becomes this blurred line of, are you a member, are you a patient? Because you finish your series of physical therapy appointments, and you've been probably using some of the same equipment that all of the members are, and so you're sometimes standing right next to them, and then you finish, and you still are using that. And oftentimes a lot of our physical therapists will come up to their old patients and talk to them when they're out there exercising and continuing that program, and or vice versa. The member might come back to their therapist when they see him out there and say, hey, here's how I'm doing, and do you have any advice? So it just, I think it works together beautifully in whatever setting it is. And I've seen and heard of really great examples of the other thing, where a physical therapy clinic then expands into the medical fitness, and I think it helps their business, but it also helps outcomes and things like that. I think Thomas, Pinnacle is a great example, right? I'm sure you can talk a lot about that, right?
Yeah. We and Jeff and I have talked a little bit about that in the past, and probably could dedicate a whole podcast to exactly this topic, right? Or a couple more episodes for that matter. But absolutely, yeah. And what I appreciated, David, about you talking about the business benchmarks is that so often the reason that if there are primary challenges in this, it's two of the things that you mentioned. One being that a physical therapist or a practice owner thinks this is a great idea. It's so intuitive. We need to have a fitness component. They buy the equipment, they hire the staff, and then don't think through the process of, how do we make this a profitable endeavor within a physical therapy clinic? And it's hard. And the other side being that the collaboration is more difficult in reality than it is in theory. That physical therapists and fitness professionals, it takes work to build trust and common understanding, and to build trust in the programs that both providers provide. So it's tricky, but it should exist. It absolutely should. And it's, part of my right now, early in my career, my life's work so far is to make that as much of a thing as possible across the United States. So absolutely.
Yeah, and just to jump right on that one, I totally agree. I think the leaders of these organizations really have to think about how to make that work, because in one facility of mine early on in my career, the two groups didn't really talk much, and it was almost, it felt like this is my turf and that's your turf, and we're gonna coexist, but we're not gonna, so one of the next facilities, I made it a goal of mine to really pull them together. And we'd have meetings together, we'd be asking each other for help in different ways. At Hancock, we were all considered part of the same team. And so, when the medical fitness center was doing something, physical therapy was right there with us. And so the more, yeah, you can bring folks together, ask folks to help with certain things. I had some of my little bit different model, but some of my exercise specialists at Hancock be trained up to be able to work in cardiac rehab. And so when they had some staffing needs, that was always a great chance to further integrate. So a lot of those types of opportunities can present themselves if you just start talking to people and asking how we can help each other.
Yeah.
You guys are killing me because, oh man, I mean, we're going to talk for the next 2 hours. That wasn't the game plan, David, but this podcast is now going to go another 2 hours. So, I was getting ready to ask you a question, because we've been talking about the words trust and collaboration for the last 20 minutes, 25 minutes. I don't know how long. And I want to tell you something that you're not aware of, and that is that in 2015 for the ACLM, and the first time I ever presented at their annual conference, it was actually a nearly 5 hour inaugural medical fitness workshop. And I co-presented, and you're going to have to help me with the last name here, but I co-presented with John, is it Caleri?
Yeah, John Kalir.
Yeah.
I know John really well. Great
So
guy.
I co-presented with him. That was the first time I ever met him. He actually led things off, and then I didn't really co-present with him again. It wasn't a true co-presentation, but at the 2018 Southeast Regional Conference in Richmond, Virginia, we present. He presented early on, and then I presented later, and in very similar presentations. And look, I'm totally paraphrasing, but what I got out of, first of all, I just love his presentations, and the first time I ever heard him present in 2015, he actually, I was revved up. I was a little anxious because it was my first time presenting at a medical conference, and he really calmed me down a little bit with his presentation. But the gist of what he would say in both of those presentations was, um, you can have the most beautiful facility with the greatest equipment and the greatest programs you offer, and competitive fee schedules and qualified fitness professionals, etc. But if you don't have the trust and the buy-in from the clinicians, it's going to fail. You really, and so we've been hitting on that. You need the trust and you need the buy-in, and then that's going to lead to that leads to, again, I was going to ask you a question, and maybe I'll still kind of ask it, but I think we've already kind of hit on what the answer is. Maybe you could just expound on it a little bit. But that's where then the collaboration comes in, and you've been talking about in services and just getting involved, and that's really what I learned for the most part in the Mount Sinai Beth Israel system that I spent 10 years in, is I was kind of forced, for lack of a better word. I only say that because I was so scared in the beginning, but Dr. Gottland wanted me to, as the medical director, you're going to give in services. They need to learn about your side of the fence. And then it was great for me to get involved with journal clubs and the in services they provided and go to grand rounds and things like that. And so that's really what's missing. And Thomas hit on it as well. Sometimes it's easier said than done. So let me also just quickly say I've absolutely been on both sides of the fence. And I think that it's frustrating, but it's also a good thing because of the perspective it gave me. Because I'm not going to name names, but I've absolutely been at worked at facilities where it was integrated into the model. The collaboration, it was integrated into the model. And then obviously that just makes for such a better environment to just be in, because now you're learning from each other and you don't feel like it's this totem pole where I'm better than you, blah blah blah. It's much more of the continuum. So I've been on both sides of the spectrum, where places that did it really well and places that thought they did it well and maybe pretended they did it well and tried to get out to their brand to the public that they do it well, but they didn't really do it well. And it was just separate entities and a lot of frustration going on and all the negative things that go along with it. So we were kind of already talked about it, but what I was going to ask you is if you could, with all that I just said, if maybe it just triggers some things that you might want to add to that, some highly collaborative facilities, which you've already kind of alluded to, but that where people are working together like they're supposed to be.
Yeah, and what's cool is going to a lot of these certified medical fitness centers. That's part of the standards. It kind of forces you to do that,
Nice.
and so most of our probably all of our certified medical fitness centers are really doing a good job at this. I was just out in California at the St. Jude Wellness Center. They just got certified, and they just have a great way of doing this. They have a huge rehab part of their facility, and it's really amazing to see how integrated the two are. I mean, I spent all day with both groups, and it's hard to get time sometimes with therapists who are very busy with patients, but they were doing a great job. And so yeah, you see this a lot. John Cleary, you mentioned, man, he was one of these guys that I met a while ago through MFA, and he's a ex-Marine, big tough guy that kind of intimidating the first time you probably meet him. Now he's a good friend. I've been over to his house in the woods in North Carolina, and good friend of mine. But I can't tell you how much I've learned from John. I mean, John probably has experienced it all, and whether it's challenges that he can help with. He just has a great perspective on how to handle things, and so that's another great example of a positive networking experience in my career. He's one that I would tell you is just he is one of the first guys I can remember talking about integrating with hospital electronic medical records. So the EMRs that help facilitate some of the referral process and are now an integral part of a physician's and healthcare providers daily lives. He was on the forefront of getting those done, and so um, he was using Technogym equipment with the outcomes tracking and doing a lot of that stuff early on, and so yeah, he's a guy that I tried to model myself after and try to ask questions and spend enough time around to learn from one of the best over time. But going back to the collaboration piece, it isn't easy. It has to be worked on. And with so many other things going on, sometimes it can feel like, man, do I have time to spend on this too? But I think the benefit far exceeds the amount of effort put in. So I think it's one of the most worthwhile things to do.
So
100%.
have a couple more questions for you, really related to maybe thinking about current state medical fitness and looking forecasting into the future. But to start, I just want to ask you what you see as the biggest problem that the medical fitness industry needs to solve or is facing today.
Yeah, you could probably go a lot of different directions with this one. Something I just said makes me think, one of the things is the hospital EMR and being linked within that workflow. Um, sometimes it's the challenge is getting in with the IT department and figuring out technically how it fits. Sometimes it's getting the support from the administration of the organization or the medical side of things. And so those are all things that I think you've seen progress happen over the last several years, and a lot more facilities are getting embedded into that, but a lot still aren't. And so if you're not in that process, it becomes harder and harder to have those referral pathways function effectively. And I think, it's great that medical fitness centers aren't 100% reliant on referrals, and there's plenty of people in the community who can come directly into these facilities and benefit from a lot of the clinical fitness programming and chronic disease lifestyle management things that are happening. But those referral pathways are very important for a medical fitness center and help. It's really it should be a two-way street too. The side door to a hospital or healthcare system should be a medical fitness center. And those folks who are coming in getting a great experience at a medical fitness center should then also be recognizing the affiliated hospital and physician practices are where they want to have their care for the rest of everything that they do. So, I think this two-way linkage needs to become even stronger. I think the EMRs are a big part of that. I think, part of what all that also leads to is the ability for programs to be reimbursed. And I sit on both sides of that fence because I think, reimbursement for programs can be a good thing. I think it can introduce new challenges that sometimes people don't think about in terms of overhead expense and additional work, staffing requirements and regulatory requirements. But it does provide a method for more people to get in. So I think a lot of forces are headed in our industry to try to position medical fitness centers and fitness centers as a whole as part of a reimbursement type of program, because as we all know, the healthcare system is broken, and it's just too much focus on reactionary sick care, etc. There's of course a lot of the value-based things going on that are helping the medical fitness side become a more important piece of population health and all of those. But I think those are all things that are challenges that we've made some good inroads in lately, but a lot more work has to happen.
Yeah, you just hit on 6 or 7 things that if we had unlimited time today, I'd love to expand on, particularly the EMR issues and some of the things that we've dealt with working in our hospital system, some of the ways that we've gone around it. And then just this idea of reimbursement, medical reimbursement being this, goose that's going to lay golden eggs, but we don't know what that would end up looking like. And I can tell you about reimbursement issues that we have in physical therapy land right now. And so anyways, I'm going to restrain myself from going much further on any of those points, but I think they were all really great. And I agree, some challenges that will be things medical fitness industry continues to face. What innovations, thinking a little bit more on the positive side of things, what innovations in medical fitness do you hope to see in the next 5 to 10 years?
Yeah. Well, and even some of those challenges, I like to look at them as opportunities. So I think the more that can be innovated to help push those things along, and some of it is just simply the collaboration that needs to happen further and further. But outside of that, I think MFA, we just had a webinar on the new GLP-1 agonist medications that are for weight loss. You've heard about Wegovy, and Mounjaro is a new one that's about to be fast-tracked on, and a lot of people are getting excited about these anti-obesity medications. And I do think they can be part of a total system that really can help people. Um, and you know, I think the problem is if people are just relying on that as the single silver bullet, because really I think to be completely successful, people are going to need to complement that with some lifestyle modifications, whether that's a program that they enroll in. And some of what you're hearing is that in, insurance is requiring that type of program, get involved with some sort of physical activity and diet initiative before they will cover these drugs. These drugs aren't cheap, and they're really being looked at now as more of a lifetime drug that you go off of it and you're going to gain this weight back. So the addition of lifestyle modification, I think, provides a big opportunity for medical fitness centers to say, okay, well, if these things are this hot topic that everybody's trying to lose weight, they're going to look to these medications to be part of the solution. How do we also be part of this and help people in a way that don't let them fall back into bad habits, to support them on this journey? Because as we know, if we're not exercising, particularly with resistance strength training exercise, we're losing muscle mass, and that's going to be a downward spiral that we don't want to see. That would, most likely most people who aren't doing that and are taking these medications are going to have that problem associated as well. So I think that's some there's some ways to innovate and take advantage of that type of market opportunity right now. I think medical fitness centers are in one of the best positions to be able to take advantage of that, especially those who are affiliated with some sort of healthcare system and are seeing this type of activity. So I think those are some examples. We, like I said, we had the webinar on it yesterday. We've got a couple of presentations at our annual conference this year. Dr. Bonnet's going to be hitting on some of that, I think, in his keynote. So I think that just kind of is a piece of how to say medical fitness needs to also stay a player in this whole new healthcare world. And some of that new healthcare world is the value-based care that now hospitals are being paid differently, so they need to operate differently. And how does medical fitness keep a seat or become even having a bigger seat at that table of how to help hospitals that are doing that? I mean, you see the numbers that are out there that show the shift to value based care, and so medical fitness really needs to be a piece of that. I think I've seen some really good examples of how it is integrated that way. But I think that's part of the future, is making sure that those types of opportunities don't pass you by, and you stay a player in those types of things.
It's really unfortunate that we have to wrap this up because we could keep going and going, but I am compelled to respond to what you just said before we wrap this up and say that I am president-elect of the American College of Sports Medicine's Greater New York Regional Chapter. So I'll start my one-year term as president in January. And as you know, one of really my primary role as president is our fall and spring conference, and the theme and finding the keynote and the speakers and stuff like that. So I already know and have gotten approval from the programming committee, that the spring conference is going to be on this obesity medicine movement. And my vision is to have a physician, like a primary care provider, as a keynote, just given the big broad overview of what are these GLP-1 agonists, what's the mechanisms, why do they work, what are the pros and cons, and maybe then a piece on the importance of exercise and especially strength training and stuff like that. And then I want to have an advanced practice provider maybe start to bring it down a little bit closer to the ground floor and talk about their perspective from more of a lifestyle medicine perspective and the importance of that. Then a nutritionist maybe talking about the importance of protein intake and all things. Then a behavioral specialist talking about that, right? Say all the pillars of lifestyle medicine. I'm actually going to present on the programming part because I have a lot of experience with this, and then maybe like a successful weight loss maintainer coming in and saying, "Here's my success story." So it's 1 day conference. It's 6 speakers. That's really the overall game plan, but it's my way of saying, man, do I believe, agree with you. And yeah, we absolutely just, the Medical Fitness Association and just medical fitness in general needs to stay current with the trends and what's going on and the movement going on. Let me also just quickly say that I think that my fall conference is going to be this idea just came on like a day or two ago. Um, and look, I don't know if I'm really going to title it like this, but uh, you just finished rehab. Now what? Whether it's cardiac rehab, pulmonary, neurological, orthopedic rehab, now what? Because everybody's going out into the abyss, and instead it should be medical fitness, and it should be like an ongoing program. So I think that those are going. Well, I know that the spring conference is going to be on this obesity medicine movement, but I think the fall one is going to be on now what, and then bring in speakers on that. So yeah, when we sign off here, I might, or in the future, I might pick your brain on this stuff and get your insight on it as well. But as we wrap this up, if you want to put in a plug, and you should, just put in a plug for the Medical Fitness Association and why you should become a member, how, and then also, how do we follow you and get to know you better through social media or wherever you're at?
Yeah, well, yeah, and first of all, thanks, Jeff and Thomas. It's been fun talking to you too. It's always great, having these back and forth conversations with people who share the same passion and interests as you. So, this has been a great hour plus for me. I always love that. But yeah, Medical Fitness Association. You can always go online, www.medicalfitness.org. That's our website. You'll see all the benefits, all the different things that we're doing, conferences, webinars, some of the resources that we provide to our members, and you can register to become a member online. um, or you can come to some of our webinars. They're completely free to everybody. If you want the CECs that come with them, our members get those complimentary. If you're not a member, you can just pay $25 each time and get those. But I think that's actually one of the really good membership benefits is the CECs that we provide. So yeah, I think, and if you get a chance to come out to Baltimore, that's the way that I got involved with MFA way back when I went up to Chicago and there was a meeting there, and interact with people. If you go, make sure that you meet some people. I'd like to shake new hands. I always do. So um, that's absolutely something to do. We have the certifications that are really, I think, a great thing that we offer the industry. So whether it be the facility certification or the director certification, uh, those are great. Like I said, I'm working on the benchmarks publication. Last year we put out a new edition of the facility standards and guidelines, so we're always updating those things as well. Um, Me, as far as social, man, I try to get to that, but it's probably best to hit me on LinkedIn. If I look at it once a day, I'm doing a great job. It's probably more like every couple of days, but yeah, you can also reach out to me by email and that way, and I will try to get back to people that way. But yeah, it's been a pleasure to be part of your podcast, guys.
Absolutely. Baltimore is an old stomping grounds. I actually grew up 45 minutes north in York, Pennsylvania. And so Baltimore and the Inner Harbor and all that, and is an old stomping ground. So I will likely be there as well. But Thomas, thanks so much for your help in all this. And David, thanks so much for being a guest. This has absolutely been awesome. Do you need assistance in connecting with a fitness professional in your local area or virtually to add this connection to your patient services? If so, please email mrfinstitute.org@gmail.com. Please also remember to check out mrfinstitute.org for information on how to learn more about the education we offer and to stay current with our podcast series. Thanks for tuning in, and we'll see you in the next episode.